Yeah.
Welcome back to the Spine Doc, and if you're here, it means you've been through 4 weeks of phase 1 and you're ready now to step it up to the next level. Now, these exercises have been segregated into 4 phases of increasing difficulty, and the reason for that is that it doesn't physiotherapists and physical therapists and in rehabs, essentially how it works is you go to a therapist, they give you some exercises. Once you've done them, you go back, and then the level of exercises increase slowly. But it's very difficult to go back and forth to a therapist. So what most people eventually end up doing is they do the same set of exercises for in a continuous mode for a long period of time. Now, that does not really benefit much because the body adapts very quickly to stimulus, and it needs to be continuously challenged with slow increments in the challenge to develop a little bit more. So, phase 2 exercises will be slightly more challenging than phase 1. This is again to be done for 4 weeks. This is to be done if you've done phase 1, you're cleared by your doctor to exercise. You do suffer from back pain, neck pain, and these kind of musculoskeletal issues. You're post-surgical, you've done 4 weeks of phase 1, then again you want to start with phase 2 now. So I'll get straight to the exercises now. This 4 weeks are going to be few strengthening exercises, more challenging than before, few stretches for the core and back extensors, and hip mobility exercises. So the first exercise is one that you had done already in phase 1. It is the straight leg raise, where you keep your knee straight and lift it 6 to 8 inches off the mat. So you do this about 10 times each leg, and then you shift to the other leg and do it 10 times again. Don't rush through it. Keep your core tight. Always remember to keep your core tight. And a simple way to do that is by keeping the belly button plastered to the spine. You imagine your belly button moving towards the spine. And breathe normally throughout the exercise. Don't hold your breath. And you want to do a total of 50 repetitions. So if you do 10 in a set, then you do 5 sets.
Okay. Yeah.
So the second exercise is a mobility exercise. This also you've done before, and these will now serve as good warm-up exercises for the next few exercises. So with your feet shoulder width apart, drop your knees to one side of the bed, keep the body as relaxed as you can, and then drop the knees to the other side. So you do this about 50 times, breathe normally. And in the second variation of this, you put your feet together instead of it being shoulder width apart.
Got it.
So now we'll go into the second variation.
Yeah.
So you see the feet are now together, and we're dropping the knee from side to side, from one side to the other side, while the upper body remains essentially in the same place. So this mobilizes the spinal joints nicely, and it's a very comforting exercise also. So this also should be done about 50 times. So once you've completed this, we move on to the next exercise. The third exercise is a posterior chain stretch. Now the posterior chain is a set of muscles that connect the buttock, the hamstrings, the calves to the spine. Now, because all of us are in a sitting job, most of us are in a sitting job, we spend 6 to 8 hours sitting a day, sometimes even 10 hours. So that posture causes contraction of the posterior chain, and that in turn leads to a lot of increase in stress on the lower back. So the aim of the posterior chain stretches is to stretch it out, regain the normal length, and slowly increase the strength. So in this exercise, you're sitting down and you slowly stretch in front up to a point you're comfortable. Breathe normally, feel a stretch in your lower back.
Okay, back to neutral.
And once you hold that stretch for 5 seconds, then slowly let go. So stretch in front, breathe normally, feel a stretch for 5 seconds, go into a deep stretch, be relaxed, and let it go. So you do that about 50 times. The second exercise is a hip mobility exercise. Seated like this, use your elbows to push your knee down, and once you're comfortable, then do it without any elbow support. So this exercise where you flap your knees up and down, you do this for about a minute.
Got it.
The
Yeah.
fourth exercise is a back extension exercise. Here you're lying down on your stomach, and this is an advancement from the previous four weeks where you're doing one hand at a time. Here you're doing both hands at a time, and then followed by both legs at a time. So you do this for about uh, 50 repetitions each, so you can break it up into as many sets as you want. If you're finding this very difficult to do, then you can always go
Yeah.
back to the phase 1 exercise and work your way up. In the second part of this exercise, this is abdominal stretch. Lying down on your stomach, put your elbows by your side
Back
and
down,
just
back up.
stretch your abdomen out until your head is all the way up. Hold this for about 30 seconds, go back down slowly, and then go back into the stretch.
Okay.
So this exercise you do for 30 to 40 times.
Yeah.
The last exercise is the exercise that we had done before, the pelvic bridges. These are few staple exercises that will remain the constant feature of every phase. So this you do 50 repetitions of. You lift your pelvis up and up till the point when the knee, pelvis and the shoulder come into the same line, and then you slowly let down. Breathe normally throughout the exercise.
One more.
Don't rush it. Do about 50 repetitions of this.
Done.
Now the internet is full of experts telling you that 5 minutes of exercise to cure your back, 2 minutes of this, any quick shortcut that helps in getting rid of any symptoms. But let me tell you this, that there are no shortcuts. In life, there are no shortcuts. You cannot have any medicine to get rid of a postural imbalance or a contracted muscle. The only way to do it is through genuine hard work where you progressively progressively challenge your body and get stronger. So these are not 5-minute exercises. Don't even attempt to do them in 5 minutes. Take your time, do them for about 20 to 30 minutes. Uh, that is just the exercise part of it. In the first 4 weeks, I had advised 45 minutes of low energy aerobic exercises like going for a small walk, a slow walk. Here, you can ramp up the speed of your walk now in these 4 weeks. Walk for 45 minutes, but change it into brisk walking, and that should be a lot. That should be enough. So if you like this kind of content, don't forget to subscribe, because then you'll get an alert every time I upload a video. And once you're done with this for 4 weeks, I look forward to seeing you for phase 3. Thank you.
Yeah.